I want to know what you think is next in your project. What do you see coming next over the next couple of years? And then what we heard today is very, in some ways, esoteric. What's the clinical relevance? How do you bring it home to clinical relevance? And by the way, that's an easier question in some areas than others, and perhaps I'm starting with the hardest one.
Am I going to lead first on all of these? I think two questions. Yeah, please. In the near-ish future, I think with larger sets of patient data, we'll have much improved statistical power to identify new genes and new sort of, at least genetically linked etiological subtypes of Chiari, and I think that's really important. And with greater clinical data also for all of the patients involved, we can then try to understand how these subtypes of Chiari can be treated better. For instance, maybe a patient with macrocephaly-related Chiari malformation as opposed to hydrocephalus-associated Chiari malformation would be watched and differently or treated differently potentially. And I think that is an important clinical outcome from what we're doing, at least from the GI standpoint.
So I really like that a lot. So, for example, somebody who has a CSF-related problem might need treatment of their CSF-related problem. Those who have, a venous outflow problem might be treated differently than brain overgrowth or, when we hear so much about, and maybe I'll ask you one more question is, we hear so much about the relationship of hypermobility to these conditions. Is there, do you know the kind of the current state of the field in terms of the genetics of that?
Yes, similarly to what we're seeing in our studies of Chiari malformation, I think the sort of underlying genetic causes of hypermobility, of scoliosis, of other skeletal conditions is also becoming clearer that there are subtleties that we can understand by doing sequencing and finding genetic variants in genes that we know are associated with these things. So, for instance, collagen genetic variants cause things like Ehlers-Danlos syndrome, and what we're seeing is that some Chiari patients have, genetic variants in those same genes, but don't have Ehlers-Danlos syndrome more overtly. And so, even with more subtle, genetic studies, we can actually try and find patients that wouldn't have been found clinically. Yes, it's pretty similar in the realm of most musculoskeletal conditions where, that it's difficult to predict in some cases, but there's a lot of overlap that we're starting to understand.
All right, Dr. Strelay, same two questions. Next couple of years, where do you see your research going, and then what's the sort of immediate and long-term clinical relevance?
I'm going to start with the second question first. So I think really in the field of CSF disorders, we're now understanding that CSF circulation dysfunction may underlie many diseases and even just normal biology, such as circadian rhythms and sleep. Kids during development may have very specific changes in how CSF interacts with the brain to guide neurodevelopment, and it's really the wide open area. So not only are we super excited to understand how CSF interacts with the brain in the setting of Chiari, but also in those individuals that have a more mild Chiari who are asymptomatic at various ages. This is really a wide open area because this is not been evaluated in children. So in addition to understanding the fundamental biology of brain movement, CSF circulation, we also hope to understand how differences in this circulation differ in patients who are symptomatic with Chiari, who are not symptomatic with Chiari, across various ages. And what I didn't mention in my talk, that is, I guess, part of the 2-year plan I'll get into is with the team that we have these images that we're acquiring, and where we started, even when the grant, was submitted, we were thinking very focused on 4D CSF flow and DBSI, and what we've been able to do with having these, imaging experts is really expand on those two imaging modalities and understand with very short, fast sequences some of these same questions that we're asking with the more detailed research type scans. So we really, so over the next 2 years, we'll be just at baseline understanding how fluid moves in the brain, how it differs with Chiari, how it's associated with outcome, but then also comparing the quantitative findings from the more detailed research scans with some newer sequences that we hope to be able to use clinically, especially in young kids that may not be able to sit still for a long scan.
Dr. Rolla?
I think I got the questions. So where I think this is going with this line of research, one of the things that I really hope that it does, and I expect that it will, I think it's going to validate some of the feelings and things that a lot of our Chiari patients tell us they experience that we have a hard time understanding. Especially when you look at the relatively simplistic view of a Chiari malformation is this problem with the cerebellar tonsils. It's got to be a lot more than that. And like you said, Dave, some of this data, some of this research can look pretty esoteric very quickly. Trying to figure out the default mode network and action mode network and rested state functional connectivity can go up the deep end really, really fast. But what it means to me, and I think what it's going to mean to patients, to kind of bring it back to the second point of how we're going to translate that to clinical care, is understanding how these networks are affected by this anatomic abnormality helps us understand some of these symptoms, help us understand this itch that some of the patients can't scratch, and helps us put a metric to it so we can measure it. Something that previously we didn't have a good way to measure or was really, really difficult to measure. Like Dr. Shrelia said, that's one of the results we're so excited about. The imaging aspect of this is because a lot of the imaging techniques are very routine to all of our clinical practice. All of these sequences that we're doing can be done on a routine MRI scanner that every hospital in the country has. And once we're able to demonstrate their utility and develop them further, we can hand them out to the rest of the world so they can use these techniques for other people with Chiari malformation. So I think that's where it's going, and I think that's how it's going to clinically translate. And I think across all of these studies, there's going to be so many metrics that are going to redefine how we think about Chiari.
Great. Thank you. Dr. Luke.
All right. So certainly, one thing we need to do is to incorporate a lot of these genetic predictors about advanced imaging modalities into the, clustering analysis, into the phenotypes, right? So that we can make our phenotypes more precise and also more robust. And of course, right, then to make clinical impacts, it's about the next step is to develop treatment, right, protocols that are tailored for each individual phenotype, right? So that we can treat patients much more effectively. Another really important area that's truly exciting is to predict treatment effects, right? We know some patients respond to surgery, some patients are less responsive to surgery in terms of getting better in their headaches, for example, responsive to different type of surgery, right? Certainly using AI models, or AI is really good at making predictions, right? You look at this data of this individual patient, then you predict, right, which surgery would be the most effective, right? This patient would get the best outcome Right? So that certainly would be personalized medicine, making the treatment much more precise and effective.
Great. Thanks a lot. I actually have a couple more questions, but I want to see if there are any questions from the audience.
And we just also would like to invite our online participants to drop some questions in the Q&A or in the chat, and we'll read those out.
Great. So what I think is interesting, and obviously we work together all the time, but I think the thing that's so interesting about this project is we're starting to make connections, right, between these various mysteries. Whether it's, and this, I actually think one of the most compelling things about what you all have presented here tonight is that at least some subtypes of Chiari seem to be brain-wide diseases, right? We saw brain overgrowth affecting not just the cerebellum, but all areas of the brain, right? Your zebrafish models have shown that nicely. Dr. Straley showed DBSI changes, diffusion changes throughout the brain, including in the corpus callosum. I think we saw one there. We certainly saw resting state networks link up between the cerebellum and supratentorial compartments and then sort of building it all together. So I think it's really, really compelling.
See, is there any questions? Oh, yes.
Hi, Annie Chiari. Hi, I'm a Chiari patient, and I really wanted to thank you for all that you are doing with your research. Dr. Rowland, what you said about the itch that can't be scratched, the pain of Chiari can't be described. Honestly, I often would call to say to my husband, it's unhonest pain because my head hurts. I knew my head hurt. But if you stub your toe, you know why your toe hurts. With the Chiari, you don't have a clue why your head hurts. And my poor husband and kids, they hurt that day after day. And I appreciate that each one of us is an individual. And thank you so much for what you're doing. We are all hungry. All of us at Chiari or head pain, you want to know what's going on. So thank you every day for what you get up and you do.
Thank you. That's very kind.
Hi, I also am a Chiari patient. I have hypermobile EDS diagnosed after neurosurgery for my Chiari. It took 4 years before I was officially diagnosed. So when we're talking about all these AI and imaging, and where would this take place in the medical world? Would that exist at the initial MRI or once someone has been referred to someone who is a specialist in this area? Like where, because for me, the breakdown was, it was there in the imaging all along, but no one actually diagnosed myself. So just for patients that are out there searching for answers, like where do you see this technology helping them?
Thank you for that question. Does anybody want to?
I'll take it because I want to brag about Jen Yang's work. For that is, I think that's one of the amazing utilities of machine learning and AI techniques is taking all the things that we're working hard to push Sindo forward and somewhat democratizing it, making it available to everybody so it doesn't have to be an expert. Some of the things that previously required an expert to look at those images to make an expert assessment can now be done by machine learning models that have been trained from the results of experts, but then put into the hands of everybody around the world. So I think that's going to be that is one of the big pieces of this project, is to make those techniques available to everybody, not just the experts in this room.
So in terms of where this is going to sit, right? So basically you would have these AI models sitting in the electronic health records where hopefully our images and our clinical notes and all the data is going to sit. And then these AI models can run on these data and screen for Chiari malformation.
And Shinya, can I take that one step further? Don't tools exist, or are they being developed to just automatically detect trends in the data in the EHR? Those are either here or emerging quickly, correct?
Correct. Right. Certainly, there are a lot of successful imaging AI models, such as mammogram. Right, it's very AI is very effective in capturing breast cancer, right, from mammogram, for example. Right. So I guess part of this project is to go toward the goal of developing AI models that can do the same for Chiari malformation.
We have a question from Brandon online, and he said the ABC study included a fairly comprehensive neuropsych battery. Do you know if anyone has already analyzed the data in regard to Chiari malformation versus controls? And he also said thank you for this great presentation.
That's a fantastic question. Tell Brandon I'll be sending him this check for answering me. I love that question. It's exactly one of the things that we designed into this study. So one of the things that we're doing is we're replicating that same NIH cognitive toolbox and the CBCDL, some of those same things that were done in the ABCD study in the patients that we're prospectively studying for this project. It has not been studied in the ABCD cohort amongst those incidental Chiari malformation subjects. That has not been studied. That is something that we plan to do. We're going to do it in the ABCD, and we're going to compare that with our clinical patients, because again, the ABCD study was essentially incidentally found Chiari malformations. But how that might have ended up in that data in some form or fashion, some of those things like Janine was just figuring out, maybe some of those individuals are people like you who haven't yet been diagnosed, and maybe they have that itch and they don't know why, and they just need something to tell them that this is what's going on. And maybe that's in the imaging, and maybe it's in some of the cognitive testing. I suspect it's in there somewhere, and I think it's our job to figure that out.
I love that my itch story has been immortalized. Did you have another question? No? Anyone else online? I'm going to end by asking one question, and this will be of the group. I think that this group is uniquely poised to answer the unanswerable questions, or the previously unanswerable questions. So what are those? What are the unanswerable questions affecting patients with Chiari?
I mean, very simply put, I think, who needs surgery is the first thing that comes to my mind. And that's what I think, your experience may have been. And we recently looked at, various message boards on the internet to understand patient and family experiences, at least as we could tell from the information that's available online. And what I hear in my clinic and what we saw from sampling this information is that Chiari patients are frustrated. They're frustrated from the delay in diagnosis, being sent from one provider to another, and I think sometimes it's clear whether or not surgical intervention is helpful. Other times it's not, and so I think one of the aspects would be to understand, who are the patients that may benefit from surgery. And I think more important to the first thing, that because my mind as a pediatric neurosurgeon is, understanding the common presentations of Chiari and the types of all the various intricacies of the types of patients that present with Chiari, so that us as neurosurgeons and neurologists and pediatricians and researchers alike can help better recommend a treatment plan, whether that involves surgery or not, to better streamline care so that someone is not sent from one provider to another and back and forth and is told, we can't help you. So I think ultimately, simply put, it's helpful from a neurosurgery standpoint to understand who needs surgery, but even more importantly, as I'm, thinking through this, is really to come up with, more individualized recommendations for non-surgical treatment for those that don't need surgery.
real quickly. I mean, I think understanding, like, as a patient, why you have just knowing that you have it is a first step to being helped and getting the right treatment, but also understanding what its cause is. It didn't cause itself, in my mind. I think to some extent it's caused by a number of things, and that's what this study is about, is trying to understand what came first. And I think genetics always came first. You were born with the genes that you have. And so to the extent that Chiari is genetic, helps us understand what came first. And helps us understand what the best way forward for treatment is.
I think those are fantastic answers. I think these are the things that, again, we see in our clinic all the time, and we're all here so passionate about this project because it's all born out of the questions that we hear from you all, from our patients in clinic. My answers to those questions have changed already since starting this project. One of the common ones is I have a QI mutation. My sister or my mother has headaches. Does she need to get an MRI? I used to say, oh, no, this doesn't run the family. And now after seeing Dr. Haller's data, I'm like, it might run the family sometimes. And figuring out, well, what's that answer? Do we do that genetic test? And what are we going to do with that data? And once we have that data, I'm going to drop into Chen Yang's machine learning model to tell me what to do with it. And then for every one of those individuals, I'm going to say, do we need surgery? Well, I'm going to look at Dr. Shreeli's CSF flow studies and tell you the answer. I think these things are going to come, and we're already excited about it.
What we want is a AI co-pilot for physicians, right? An AI model, an AI agent can look at the data, right? Detect Chiari malformation, recommend, identify what subtype of Chiari malformation this is, recommend treatment plans at a personalized level based on predictions about treatment effect of this individual. Right? Of course, the decision ultimately is on our physicians and surgeons, but AI can provide the additional insights and information that help make that process much more efficient and hopefully more precise as well.
Great, thanks. And I just want to make the point that the story about the itch was true, and we now collect data on neuropathic itch and on every patient. So the reason I say that is because what is referred back to us here in sessions like this or online really does become part of the data we collect. So I just want to add one last thing that I think is a great unknown, and is pain. How can we relate, how can we unravel the connection of pain to this combination of disorders? I think that is a great unknown. I think cognition, Dr. Rowland is working on helping us to clarify that. And of course, the relationship of hypermobility and EDS. And I think those are some of the things I think are the great unknowns as well. So Tanda, you want to say a word or two?
Yeah, I just wanted to say to Dr. Limbrick's point about cognition, these are 4 of a 36-member team that are representing genetics, neurosurgery, and engineering. But we also have people from the Department of Psychology and Neurology who are looking into cognitive testing, and we're doing that on our new cohort of patients. Right now, we're still in the infancy of that research, so we didn't have much to share, but certainly coming soon, you'll see more on that. I know a lot of our participants had shared with us some brain fog or maybe some thoughts their thinking isn't quite clear, and so we're investigating that as well.
All right, well, thank you so much to all the participants, to everybody in the crowd, to everyone online. Thank you for this, and we're going to continue to do this on an annual basis and be able to hopefully give data updates and have conversations like this to inform the research going forward. So thank you all.